I'm Dr. Tanya Selak. I'm a specialist anaesthetist. I work in Wollongong. I've been a consultant for almost 20 years now. So anaesthesia is an incredible job to have, and I think a lot of people have many misunderstandings about what an anaesthetist is. A lot of people don't realise that we're doctors. A lot of people don't realise that in fact we're specialists, and it takes a really long time to learn to do what it is that we do. We're so privileged. We take care of patients many times when they're in the operating theatre and look after them whilst a surgeon might be sorting out what's wrong with them, like maybe sorting out a broken leg or dealing with their cancer. And we give them medications, often get them off to sleep, and take care of them whilst that process is occurring. It's such an incredible career. So when we first meet a patient, often in an anaesthetic bay, it can be a really confronting time for them. Many of our patients haven't been in hospitals before. They might come to us with a new diagnosis that can be really frightening for them, like cancer or a broken leg or bleeding or being sick in some other way. So it's really important for me as their anaesthetist to let them know that I really care about them and that I am going to look after them whilst they are anaesthetised for their operation. And I want them to know that I am going to really look after them. So we have a number of conversations in the anaesthetic bay about all the usual things that we do, their medical problems, their medical history, have they had anaesthetics before, that sort of thing. But really their social history is, for me, the most important. I want to know who's at home with them. What do they normally do? Do they work? Are they at home? Are they studying? What do they normally do today on a Wednesday? That's really important to me, and in particular to reassure them that we will look after them, that our team is there to make sure that they are safe and that we are keeping their whole person in mind as we treat their disease process. Many times people say to me, "Oh, you do anaesthetics because you don't want to talk to people." That's a common misconception because, oh, your patients are asleep, so you don't need to talk. I actually think it's quite the opposite. I think one of the most important things for an anaesthetist is to have excellent communication skills, because sometimes we have a very short period of time to meet our patients and to talk to them and to let them understand what's going to happen, to get information from them, to work out how they would like things to proceed. But furthermore, we have their patients' families to consider, and also all the members of our team. We work with surgeons, nursing staff, administrative staff. So we have to be able to enter a room, communicate with all these different people. Sometimes there's high tension and high stress. So we need to know how to de-escalate situations, how to get the best out of every team member. It's so interesting because sometimes we work with teams that we've worked with for 10, 20 years, and that's a really easy way to work. But also sometimes we find ourselves in teams where we know no one else in the team. And in a really short period of time, we have to get control of a situation, ask everybody to perform their roles at their highest standards so that we can get the best outcome for our patients. Everything excites me about anaesthesia. I've been doing it for 20 years and I just can't believe that this is my job. How lucky am I to go to work every day, to go to a hospital, to work with an incredible team of really dedicated people. I mean, hospitals sometimes get a bit of a bad rap, but the work that we do every day with our patients is just incredible. And I'm not talking about the stuff that you read on the TV, the high-end, cutting-edge, really pushing medical science stuff. That's amazing as well. But the so-called ordinary things, someone's got a broken ankle, someone's having their appendix out, someone's having their head and neck cancer dealt with. These are very routine things in the hospital and in the operating theatre. But we as teams come together with our patients at the centre and are able to assist them. And I think in these times, perhaps there's not that many jobs where you are just there to serve and to be of use and to be helpful and to try and make someone's journey better. In the hospitals where we work primarily, communication is actually the most important thing that we do. All of the time I'm having to communicate with our hospital administrators, people who are running the theatre, nurse unit managers, patients, patient groups, intensive care, other craft groups in the hospitals. I would say I spend a large part of my day communicating with other people to try and run our operating theatre efficiently and that our patients can get into theatre and get safe care so that they can get on their way to recovery.